Hello, everyone. Welcome to this week's Let's Talk Wellness. If you are a regular and you've been coming every week, you know that this week, April 19th, we'll be talking about alcohol and substance abuse with one of the PSEG medical team members, none other than Elizabeth Dicubellis. She's going to be having an informative talk about recognizing the warning signs of a substance use problem, how it can impact your mental health, and learn about a lot of the resources that are given to PSEG employees that are highly effective, and especially during this time period, are being utilized much more than they were in the past to really great success. So without further ado, I am going to introduce Elizabeth. Hi, Liz. And she's
Thanks so much, Nick. All right. Thanks for that intro, Nick. Good afternoon, everybody, and thank you for joining me today. As Nick explained, I am a manager here at PSEG in the medical department of HR, overseeing mental health, substance abuse, and regulated medical programs. So talking about alcohol and substance abuse, also, it's not only a part of my job, but it is personally a passion of mine. I have experienced alcohol abuse issues personally and have successfully overcome those issues. And so I'm so passionate about raising awareness on this topic and showing people that there is help out there and that you can live successful, happy, productive lives. And it's not something to be embarrassed or ashamed to talk about. So let's jump right in, Nick. So April is Alcohol Awareness Month. This started back in 1987 by the National Council on Alcoholism and Drug Dependence. The goal was really to want to reduce the social stigma associated with alcoholism and also the shame that goes along with alcohol or substance abuse issues. We're really working towards normalizing the conversations around this topic. Most of us, if not all of us, will either experience an alcohol or substance abuse problem. We'll have a family member, a parent, a child, a significant other, a coworker, someone in their lives experience alcohol or substance abuse. So getting comfortable with this topic is so important, so people don't have to live in shame and isolation with this issue. We really want to be able to talk about alcohol abuse and substance abuse the way we would other physical health conditions, right? Nobody cringes when you say, hey, I got to go to the orthopedist because I've got back pain, or, oh, I'm going to see my cardiologist because I have blood pressure issues. But nobody wants to say, oh, I'm going to my psychiatrist because I have addiction issues, or I'm going to see a therapist to work out why I use alcohol or substances, right? So by joining this, webinar today, you're already helping that cause of getting this conversation to be more normalized. Next slide, please. Drinking habits. Why do they matter? As Nick had said, we all have just lived through one of probably the craziest times in our lives. When COVID hit in March 2020, we all went into lockdown unexpectedly, not knowing what was going to happen next. And this had a huge impact on substance abuse and alcohol use. At this time in the United States, alcohol and drug use is at a crisis level. Employees, both part-time and full-time workers, found increasing use of alcohol and drugs during the pandemic, especially those who were working remotely. A lot of people, they say about 75% of the workforce worked remotely at some point during the pandemic. And 38% of that population reported drinking more alcohol, and an additional 18% reported taking more drugs during the pandemic. And again, those numbers are higher because those are only the numbers that are reported. So people working remotely were more likely to report increased alcohol and drug use, and you wonder why, right? Possibly to cope with the stress, to cope with the fear. Maybe it's more accessible when we're home. Going into work gave us structure, right? You got up in the morning and you showered and you brushed your teeth and you ate breakfast and you got in the car and then you commuted and then you had your 8 to 10 hour day and then you commuted home and you had structure in your day. And during the pandemic, you kind of lost those guardrails on how to live your day, right? The lines are blurred. You roll out of bed into your office, right? It's lunchtime and you haven't had breakfast yet, and now the kids are trying to study while you're trying to work, and all sense of normalcy has kind of gone out the window, and a lot of people picked up drugs and alcohol in order to cope with that. It's very common for people to minimize or justify the impact alcohol or substances have had on their lives. So one thing we ask is just to take a moment and reflect back on the last year or two during the pandemic, especially during lockdown. And have you noticed, or can you reflect back and see where maybe you or someone that you live with or someone close to you that may have increased their use of alcohol or substances, right? And if alcohol isn't an issue, think of another substance. It could be nicotine, right? Did you notice that you're smoking more cigarettes, or you're vaping more because you're not at work? Or maybe you're, eating sweets now because you're not eating your breakfast, lunch, and dinner the way you used to. So, you can insert anything. It could be a prescription medication. It could be marijuana. So, when I say drinking, think of any substance. How did it affect you? Or how did it affect that person in your life? There's various levels of negative impacts that drinking or substance use can have, varying from mild to moderate to severe. Most people, and not that everyone that picks up a drink has an alcohol problem. Let's be clear about that, right? There are plenty of people who have a drink or two, and that's it. It doesn't affect their life in any way. They're not obsessed about it. They're not thinking about it all the time. But there are plenty of people who have symptoms that can interfere in so many areas of their life that may not seem so obvious, right? Financially, it can affect you, can have relationship problems. Physically, it can affect you. Mentally, emotionally, it can affect you. It can affect you at work. There's so many different areas of our lives that alcohol abuse and alcohol use and substance use can affect. Just real quickly, some short-term issues of alcohol abuse medically that they could have on you. Some acute symptoms, headaches, blacking out, not remembering what happened when you drank, nausea or vomiting, diarrhea, distorted vision, impaired judgment. And then we go on to long-term effects of alcohol abuse, right? Permanent brain damage, cirrhosis of the liver, high blood pressure, hand tremors. People tend to get very shaky after abusing alcohol for a long time. Compromised immune system, malnutrition and vitamin deficiencies, cancers of the mouth and esophagus. So as we can see, there's an array of symptoms and consequences as a result of alcohol abuse. And one other area to touch upon are those that are not medical, not mental, which it can affect, right? And we're going to talk about that a little bit more, affecting us emotionally and mentally. But as I stated, it can impact relationships with family members, friends, our coworkers. We may isolate, right? We may not want people to know that we have a drinking problem, so we spend more time alone to try to hide that issue. We may have lapses in memory. We may have trouble, or we might be forgetting things. Avoiding social events where alcohol isn't involved, right? Like, oh, I don't want to go to that 2-year-old's birthday party because they're not going to have alcohol. Having issues at work, right? Not showing up on time or calling out of work because either you're drunk or hungover from the night before. And feeling, another thing I always like to touch upon is that feeling of guilt and shame, right? A lot of people feel that as a result of their substance or alcohol use, and then sometimes pick up more substances to try to deal with that shame and guilt that they're feeling, to try to numb that, right? And it becomes a vicious cycle. So what we want to next talk about next, so what is a standard drink? If you could go to the next slide, Nick. So surprisingly, a lot of people don't realize what differs in what type of drink that you're having, right? The amount of alcohol content, right? So if I'm going to have a pint of beer, or I'm going to have a shot of vodka, the amount of alcohol in each varies significantly, right? A pint of, 12 ounces of beer, 5% alcohol. one shot of vodka, 40% alcohol, right? So just to give you a visual image, I'm not going to read across the board here, but as you can see, beer versus wine versus liquor, different amounts of alcohol in each. The FDA, just as an FYI, states that moderate drinking is no more than one drink per day for a woman and 2 drinks per day for a man. So what is binge drinking now? So we know what a standard drink looks like. We know what moderate drinking is, 1 drink a day. What's binge drinking? It's defined as consuming 5 or more drinks on an occasion for men, and 4 or more drinks on occasion for women. Binge drinking is most commonly associated with a regular pattern of alcohol use, usually that Friday or Saturday, Sunday, that weekend time frame, and people may sometimes justify that, right? Well, it's the weekend, I don't have work. It's not a problem, right? But not the case. We see that 1 in 6 adults binge drink, and 25% of them doing so at least weekly. That's a huge number. 90% of US adults who drink excessively report binge drinking. It's huge, huge. The other thing that comes along when we talk about drinking, so we talk about what is 1 drink, we talk about moderate drinking, we talk about binge drinking. What about that high functioning drinker, right? We've heard, many people have talked about, they're a high functioning alcoholic, right? So almost minimizing the fact that they have a drinking problem because they're still able to, quote unquote, function in other areas of their life. And a lot of times this looks like somebody externally who may still have it together, right? They have a great career, they're educated, they're paying their bills, they have a house, they're taking care of their hygiene, but doesn't mean that they're not struggling, that they're still not physically being negatively affected by their alcohol use, and they're not being emotionally affected by their alcohol use. Researchers and specialists estimate that as much as 50 to 75% of those with alcohol use disorders are able to function at a high level in many areas of their lives. And I believe that this really is why so many people don't get help, or it takes them a long time to, look, I have a job. Oh, I take care of my kids. Oh, I have a nice house. I don't have an alcohol problem, right? And that really can prevent people from seeking help that they need. Nick, if we could go to the next slide, we want to get a little bit dive into alcohol use disorder a little bit more. So this is a terminology used, and it's a medical condition, and I like to emphasize medical condition, characterized by an impaired ability to stop or control your alcohol use despite adverse social, occupational, or health consequences, right? So despite having something negative happen, I'm still going to drink anyway. And I use this analogy. I'm allergic to chocolate. You guys could make noises, I'm sure. I'd be like, oh my goodness. Chocolate, if I have chocolate, I get hives all over my body and my throat closes up, right? Negative consequences. Knowing this, I do not have chocolate. If chocolate touches anything on my plate, I do not have it, I throw it away. I compare that to alcohol, right? People who have an alcohol problem have a negative reaction to it, know they're going to have a negative reaction to it, but still take that drink, okay? So alcohol use disorder encompasses alcohol abuse. So it's, as you can see to the right, it's a spectrum, right? Mild, moderate, severe. So there's alcohol abuse, alcohol dependence, alcohol addiction, and as we've all heard the term, alcoholism, okay? Alcohol use disorder is one of the most significant substance-related problems in the United States, and alcohol is the 3rd leading preventable cause of death in the U.S. Wow, that really blew my mind, that statistic, when I read it. Again, I like to emphasize that alcohol use disorder is recognized as a medical disease. It's not only a social issue, it's not a mental health issue, it's not someone who's crazy, it is a medical condition. And what do we do with medical conditions? We get treatment and we get help. right? And so we're going to get into what resources we have in a few minutes. Before we get there, what increases the risk of for alcohol use disorder? There are certain, now none of this is guaranteed, right? But there are certain things that could say, oh, these are factors that increase our risk of having an alcohol use disorder. One of those being drinking at an early age. Another is genetics, a family history of alcohol problems. And a third factor would be mental health conditions and a history of trauma. We're going to talk about mental health a little bit more. So I'll get into that in a few minutes. While we're on this topic, there are warning signs of alcohol use disorder. And again, it may be yourself, it may be somebody in your life, right? Like I said, it could be a parent, a child, a husband, wife, coworker, friend. And a lot of times there are indicators that somebody might be struggling with an alcohol use disorder. And here are some questions that I ask you to ask yourself, or if you're thinking about someone in your life that you think may be struggling. Have you had times when you ended up drinking more or longer than you intended? Have you ever wanted to or tried to cut down or stop drinking but couldn't? Have you ever wanted to drink so badly that it consumed your thoughts? Like, I just can't wait to get home because all I want to do is drink. You know, it takes over kind of our thought process. Have you cut back on activities or things that interested you? Maybe you're no longer going to the gym, or you're no longer participating in that bowling league, or maybe you're no longer going to family events because of your alcohol or substance use. Have you ever continued to drink even though it caused you to feel depressed or anxious? Have you ever found that when the effects of alcohol were wearing off that you had withdrawal symptoms, such as trouble sleeping, restlessness, a racing heart, feeling low? A seizure is also when somebody is physically dependent on alcohol. When they do not have it, they could have a seizure as a result of withdrawing from that. So these are some questions I just suggest asking yourself, and if any of them resonate, it might be a time to take a look at your substance or alcohol use. Next slide.
Go.
Okay. Can I drink while taking this? I'm just going to say across the board, no. I'm not a doctor, so I don't want to get into the specifics of each medication and mixing with alcohol, but mixing alcohol with anything from as simple or over-the-counter as a Tylenol or Advil to something prescribed like a painkiller like Percocet or Ambien to help you sleep. It is dangerous to mix drugs, or mix alcohol with your medications, right? Most prescriptions will come with a warning label. Do not mix with alcohol. I strongly encourage that you don't. And I also strongly encourage, if you are taking any type of medication, that you do talk to your physician about having a drink while taking that medication, as we certainly do not want to risk any type of medical reactions to those, which can certainly happen, okay? Next slide, please. Okay, important to know statistics about alcohol abuse. We had showed you what is a standard drink, and your blood alcohol level, you know, is an individual rate. So it could be affected by how much you drink, how fast you drink, what your body size is, what your gender is, if you have food in your stomach, you have a sugary mix in your drink, right? So there are multiple factors to how your drinking will affect you. This is a staggering statistic. Over 14.5 million people over the age of 12, right? So we have people over the age of 12 who are struggling with alcohol use disorders. That's young, you know, that's very, very young. And this number upsets me even more. Less than 10% of that 14.5 million of those receive treatment, right? that's why we're doing webinars like this, because we need to get the people who want and need help access and knowledge and awareness of the resources that are available. And again, having these conversations, normalizing the topic of alcohol and substance abuse, I think will help people not feel so embarrassed or ashamed and be willing to reach out to get help. Another interesting statistic or fact, a lot of people will say, oh, alcohol helps me sleep. You know, I like to have a drink before I go to bed because I have trouble sleeping. Well, it may help you to fall asleep. I won't doubt that. However, it does impact your REM sleep, which will really impact the quality of sleep that you have. So although you may fall asleep quickly, you will probably not fall into that deep restorative sleep. And that will impact you the next day. It can compromise your motor impairment, impair your judgment, impair your decision-making. You're more likely to have excessive daytime drowsiness, poor concentration. And this is also a safety risk when it comes to work, right? Driving, operating heavy machinery. So it is strongly encouraged that you stop drinking alcohol at least 4 hours before you go to sleep. Another thing I hear often is, you know, I'm drinking to calm my nerves, right? Or I'm going to drown my sorrows in alcohol. Alcohol is a depressant, in case you didn't know that. So if I'm already feeling down, if I'm already feeling sad, if I'm already feeling depressed, and I'm drinking a depressant, probably not going to feel happy. In fact, alcohol is known to exacerbate depression in somebody, and also can make antidepressants less effective. So like we had said earlier about mixing medication with alcohol, especially antidepressants, your antidepressants are less likely to work when mixing with alcohol. And as far as anxiety goes, a lot of times when people are withdrawing from alcohol, so maybe I had a lot to drink the night before and I wake up the next day, I tend to feel more anxious. My heart may be racing, I may feel more shaky. So there's it's kind of like a chicken or the egg. Some people will say, oh, I'm feeling depressed, I'm feeling anxious, so I had a drink or a drug to help deal with those feelings, right? And other people say, oh, I had a drink or a drug to have a good time, and then I started feeling depressed or anxious, right? So it can go both ways. Chronic alcohol or substance abuse can lead to depression, anxiety, and depression and anxiety can lead to alcohol or drug abuse, because a lot of people who are not being treated properly for their mental health issues tend to self-medicate with alcohol or other substances, right? So we can see how those two really can go hand in hand. And next slide, Nick. So I know we are running out of time, and I don't want to keep anybody too long. Before I quickly go over these emotional well-being tools from PSEG, you know, I just want to say that if there's anybody that you know or you yourself question if you have a problem, think you might have a problem or want help, reach out. Absolutely reach out. Is nothing to be embarrassed about, is nothing to be ashamed of. There are groups like Alcoholics Anonymous that are peer support groups where you can go to receive peer support from people who are struggling with the same issues as you. And they also have what's called Al-Anon. And those are for the family members and friends, relatives of those who drink, right? So if I have a significant other or a family member who has an alcohol or substance abuse problem, as a family member, I may be affected by that. So there's Al-Anon, where it's a support group for the family members and loved ones of the alcoholic to get help. So I just wanted to mention that. And then we have our amazing emotional well-being tools here at PSEG. We have Horizon Behavioral Health. So if you're looking to get any type of, whether it's inpatient, outpatient treatment for anxiety, depression, substance abuse, alcohol abuse disorders, you're definitely going to want to reach out to them. And then another important resource is our EAP Okay, we have Beacon Wellbeing for the New Jersey side and CCA at your service for Long Island. You have up to 6 sessions free, and it is kept confidential, so I highly encourage you to reach out to them if you're having any type of issues. And if your family member's having issues, you can also contact them as well, and so can your family. And then we have Next Steps from Virgin Pulse, Health Coaching, and Be Well. Because at the end of the day, it's a mind and body disease, so it's really important that we take care of both our body and our mind. And with that, I will pass it back to Nick. Thank you so much for joining me today.
Great. Thank you so much, Liz. Really appreciate it. I'm going to put up the voucher slide here. And I really although I did just say it, Liz, thank you so much again for coming in and talking about this. We're really hoping that this month we're able to open up the comfort level for a lot of people to want to talk about this and not have it be so taboo. So you giving us anecdotal evidence and also having the knowledge behind it, Liz, is incredibly impactful. And even if it reaches one person in this group, that's a win. It's absolutely a win. Again, if you yourself or somebody who may need some help, please do not hesitate to reach out. There's no sense in allowing yourself or others to suffer, needlessly. There are tools, there are entire groups, and as always, it's entirely confidential. Even if you were to reach out to anybody on the Be Well team as well, we'll immediately forward you on to Liz and her group and get you the resources you need. If you don't want to go that route, we'll try to hook you up with something like Beacon, maybe try to walk you through that, get you a little bit more comfortable with the idea of the program. That's exactly what we're here for. And we want to make sure that everybody really does know that this entire team is here to support you and benefit you 100%. This being that we just came out of such a weird time period, the number of people, as Liz said before, who are going through this type of not so great situation is higher than you would expect. At any given time, you're more than likely in a room with somebody who was going through it. And if we can just continue this conversation, you can spread it on out to your friends, your family, fellow employees, leadership, encourage them to have these conversations, because while it might be a bit uncomfortable for you at first, we owe it to ourselves, our family, and our coworkers to normalize this conversation and make it a bit more commonplace, because it's so much more common than we think. It does not need to be taboo whatsoever.